Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Meralgia Paresthetica, also called Lateral Femoral Cutaneous Nerve Entrapment. This is a mononeuropathy and it is usually unilateral. This is a one-sided problem. And also it is a cutaneous nerve entrapment. So the motor function is not hampered, only the sensory function is disturbed in this clinical condition. Meralgia paresthetica is a condition characterized by tingling, numbness, and burning pain in the outer thigh. We can say anterolateral thigh, increased sensitivity or altered sensitivity and pain to even a light touch. So if someone do the tinal test below the inguinal ligament, just 2 to 3 centimeter below and medial to the anterior suprailiac spine, then this type of sensory disturbance will be aggravated. These symptoms commonly occur on one side of the body and might intensify after walking or standing. It also intensifies when there is excessive extensor movement of the hip joint. It occurs when the lateral femoral cutaneous nerve, which supplies sensation to the outer thigh means anterolateral aspect of the thigh, upper part of the lateral and a part anterior surface of the thigh, which supplies the sensation to the outer thigh, becomes compressed or irritated. The symptoms are typically worsened by standing or walking and may be relieved by sitting or lying down. Now we learn some anatomy. So our nerve of interest is the lateral femoral cutaneous nerve, and this nerve is coming out of the lumbar plexus. This is lumbar plexus that is related to the psoas major muscle, and from there we'll get one of the branch lateral cutaneous nerve passes over the iliacus muscle, passes underneath the inguinal ligament and supplies the upper and outer part of the thigh like this. This is the area of distribution of the lateral femoral cutaneous nerve, and this is this nerve, and its root value is L2, L3. It is originating from the lumbar plexus. Supplies skin on the anterior and lateral aspect of the thigh. You can say the upper thigh, upper 2/3 of the thigh. Okay, we got the anatomy. Now we'll go to the causes of Meralgia paresthetica. We already discussed tight clothing, wearing tight belts, pants, and other clothing that compress the nerve. Obesity, increased weight can put pressure on the nerve. Not only that, in case of very much protruded abdomen, there may be some type of tumor may compress the lateral femoral cutaneous nerve. That may lead to Meralgia paresthetica too. Pregnancy, changes in the body weight and posture during pregnancy can contribute to nerve compression. Certain activities that involve repetitive movement or prolonged standing can aggravate the condition, or extensor movement, extensor muscles activity, extension of the hip joint also aggravate the Meralgia paresthetica symptoms. Okay, injury, direct trauma to the inguinal region may be due to any type of surgery or direct trauma, due to violence, there may be scar tissue formation that may entrap the lateral femoral cutaneous nerve, okay, and that may lead to meralgia paresthetica. Diabetes mellitus may be linked to the meralgia paresthetica. Treatment option for meralgia paresthetica focus on relieving pressure on the nerve and managing symptoms. This may include conservative measures, changing clothing habits, losing weight if applicable. If the person is obese, then that person can lose body weight, and avoiding activities that worsen symptom like some type of sports game, so the patient may take rest and avoid those movement of the thigh or or the lower limb. Medication: NSAID, non-steroidal anti-inflammatory drug like ibuprofen or other pain reliever, even paracetamol or Tylenol may be used to alleviate discomfort. Physical therapy: a physical therapist can help by giving some type of exercise, stressing exercise to relieve pressure over the lateral femoral cutaneous nerve. Injection, corticosteroid injection around the nerve can help reduce inflammation and relieve symptoms. Surgery in severe cases that does not respond to conservative treatments, surgical decompression of the nerve may be considered. And that's all about the meralgia paresthetica. It is a mono nerve entrapment. We can say mononeuropathy. It is unilateral. It is a cutaneous nerve. There is the lateral femoral cutaneous nerve that is coming from the L2, L3 root value from lumbar plexus, that is usually compressed underneath the inguinal ligament, may be compressed in the pelvis or the iliacus by a pelvic tumor, and that may lead to the meralgia paresthetica. So if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.